With respect to the imaging, it's absolutely crucial that you understand now what you're looking at, because you can see more structures. You have to see and know where they are three-dimensionally in ways that we really hadn't looked at before. We didn't need to. We didn't have the technology to do that. We understood from the anatomy that those structures were there, but now we had access to them, so we had to certainly dust off that knowledge base from dental school for me 35 years ago. And when I got into doing this three-dimensional radiology, we sat for 2 days and just taking apart skulls on PowerPoint presentations, looking at them and seeing how those structures now looked on a three-dimensional scan that I would be looking at. So that was invaluable. And I began that scanning technology in my office just about 6 years ago. So I was a bit of an early adopter in having that in-house. And that would be another thing that sets us apart, is the use of that technology, the three-dimensional, in our case planning, our diagnostics, etc. And so when we're looking at using our three-dimensional technology, one of the benefits of having that is that I can plan where to place a dental implant three-dimensionally. So I can do a virtual surgery on my x-ray, place the implant knowing exactly where it's going to go and to what kind of bone that I'm going to be placing it, and then have, out of that analysis, created what's called a stent and a surgical guide, So I can then bring to the mouth at the time of surgery my pre-oriented set of data, put this little guide in the mouth and do my drill holes for placement of the implant very precisely into those guide holes. So my implants are in alignment with my pre-oriented direction and depth, so I know what my outcome is going to be with a high degree of certainty. So I have precision from the very beginning through the middle to the end, and then the final restoration that's going to be on that. So that type of technology has made all the world of difference in our practice in dentistry. And then when we couple that with our three-dimensional virtual crowns that we can have, I can do we call a crown down implant. So I take what my crown is going to be, or the false tooth that's going to sit finally in your mouth. I plan where that's going to sit, then I can see where the orientation of the implant in relation to that crown has to be within the available bone. And that's why I can offer a very nice, precise, very predictable outcome in my dental surgeries when I'm doing my dental implants.